Hello, I'm Dr. Katie Marcus, one of the veterinarians here at Frontier Veterinary Hospital. Just looking to kind of talk you guys through a little bit what we do in an exam. Dr. Beadle is going to demonstrate cat exam. Hunter and I, this is Hunter, we're going to kind of talk you through a little bit of what we do with an exam. We already actually have Hunter up on our table, and this table is a lift table so that we can raise him up to level, and it's actually already a scale as well. So we've already gotten a weight on Hunter so that we can talk about, is he overweight, underweight, what do we need to do with that? When I do an exam, everybody does them a little bit differently, but what I usually do is I kind of start from one end and I work my way down to the other. And sometimes I'll talk to clients, so I may talk to you as I go along. But Hunter's got his little rawhide to keep him nice and calm, and he can hang on to that. But I do a quick look in their eyes, want to take a peek at both eyes, look and see if the whites of their eyes are nice and white, are they red and irritated? Take a look in those ears, see if they're red and irritated, if there's any discharge from them, do they smell funny? It looks like I'm giving him a pet right now, but I'm actually feeling under his chin. He has some lymph nodes that are underneath there, so I'm feeling those to feel if they're bigger than they're supposed to be, if they're painful, if there's anything going on with them. While he's holding on to his rawhide, I'm going to take a peek at his teeth. Very important, I am also the dentist for Hunter, so we want to take a peek at those teeth, top and bottom, front and back. Take a peek and see if he has dental tartar on there in case he needs to have his teeth cleaned. And again, it looks like I'm petting Hunter, but I'm just working my way down his body, and I'm trying to feel if he has any lumps or bumps anywhere, anything that's not supposed to be there. A lot of times we'll go ahead and pick up their legs one at a time, make sure that he's comfortable and easy with having his legs picked up. Want to make sure he's not painful on any of those legs, anything along those lines. All four, Hunter. There you go. Okay. Another thing we like to do is we like to feel their belly. Inside their belly, they've got all sorts of important organs, and this gives me a chance to feel them. Are they in the right size? Are they the right shape? Are they in a different location than they're supposed to be? Is he comfortable? And Hunter's more than happy with this. He thinks he's getting massage out of the deal, but I'm actually getting some information, and I can feel that all of his organs, all the right size, in all the right places. So he's looking pretty good so far. Hi, silly man. So another thing we like to do is we listen to their heart and lungs. Want to listen to his heart go thump, 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 thump. Make sure it's a nice steady rhythm, that there are no unusual sounds to it. So stethoscope goes in my ears, and Hunter's already got his mouth closed, makes it easier for me to hear. Count briefly to see how fast it's beating. Oftentimes we'll also feel their pulse to make sure that they're happening at the same time. Good. Listen to his lungs on both sides. Good. And Hunter's heart and lungs sound good. No going anywhere just yet, bud. I know. Always like to look at their skin and hair coat, make sure they have a nice shiny hair coat. Use a little bit of a flea comb to kind of go through a little bit. Want to see if we pick up any fleas or flea dirt or flea poop. Hunter doesn't have any today. He's on some good flea medication for us, so he is in the clear. Looking good. Another thing that we'll do, and I already picked up his legs a little bit, but especially on big dogs like Hunter, I'll go through range of motion with their back legs. Make sure he'll stretch his legs out for me nicely. Good kiddo. Good kiddo. Yeah, you good boy. There we go. Want to feel his tail. He's been wagging it all day today, so probably not a painful tail, which is a good thing. So for Hunter, we've already done a fairly good exam on a number of different things. A couple of things I do a little bit more closely. We pull out an otoscope. Gives us a chance to look a little bit farther down in his ears. Good. Yeah, I know. Both sides, kiddo. We got two ears. We got to peek at both of them. Oh, did you want that back? Yeah. There you go. Good boy. You can't go anywhere just yet. Good. And then I'm going to trade out and use my ophthalmoscope. Nice, bright, shiny light so I can look a bit closer into Hunter's eyes. I know. Bright lights, kiddo. Hold still for me. Good. That's a good boy. Look at this one, too. Good. Yeah? What do you think, bud? What do you think? So that's a lot of what we do in our exam. That might be a little bit briefer than we would frequently do, But Hunter's a happy, healthy kiddo who was in not too long ago, and everything was looking good for him then. So we've started at his nose, we worked down to his tail, we kind of went top to bottom as well. Listened to his heart and his lungs, felt inside his belly. Hunter, what do you think? Are we done? You good boy? Hunter's in pretty good shape, and he is done with his exam today.